Hello, everyone. Welcome to today's Make a Difference webinar, which we're running together with Westfield Health. Forgive me, I'm a bit croaky today, so for those of you who know what my voice is like, apologies. For those of you who don't, it's not normally like this. For those of you who don't know me, my name is Claire Farrow. I'm the Global Head of Content for Make a Difference Media, and I also oversee the content for our sister event, the Water Cooler, which is coming up on the 7th and 8th of May. I also run the Make a Difference Leaders Club. With nearly 350 registrants for today's webinar from a whole host of organisations, we've had another fantastic response to today's webinar, which is focused on, as you can see, supporting the health and well-being of non-desk-based workers, key challenges and practical solutions. It's clearly an issue that many employers are grappling with. The pandemic showed us clearly that non-desk-based workers play an essential role and their health and well-being is more important than ever. Yet employers often struggle to address the unique challenges and that non-desk-based workers face on a daily basis. Today, we're going to help you get answers to your questions. So we're going to hear from Kate at Westfield Health, some research that you've been doing. And also we're going to then hear from three fantastic employers. We've actually got a really brilliant panel. Thanks for joining us there, Karen, and Faraz and Penny. But before we get going, I'm going to just do, whilst we're waiting for the last few people to join, we're going to have a quick poll just to find out where you're up to and to kind of understand your information needs. So Manny, do you think you could launch the poll for us, please? Okay, so it's three questions. So first of all, what roles are your non-desk-based workers fulfilling? Choose all that apply. So we've put there logistics, warehouse, manufacturing, construction, retail, healthcare, other. And if it's other, because there are many different non-desk-based worker roles, could you pop it in the chat so that we've got an idea? What are the main challenges faced by your non-desk-based workers which are impacting on their health and well-being? Low health literacy, psychosocial hazards, pressures from outside work, physical demands, shift work or other. And final question, how advanced is your support of non-desk-based workers' health and well-being? So do you either know this is an issue that you must address but are struggling to get started? You have a range of health and wellbeing support initiatives in place but are struggling to get non-desk-based colleagues to manage them, to engage with them, or you're interested in how changes to shifts and agile working can form part of a holistic approach to supporting non-desk-based colleagues. So that's multiple choice as well. And thank you, people who are popping into the chat. So we've got some hospitality there, which is interesting to see. Chefs, cleaners, maintenance workers, etc. Account managers who are field-based, that's interesting. Traffic officer and vehicles. Bank branch, yeah, I hadn't really thought about that, Kate, I don't know about you. Conservation work, landscape management and nature monitoring, of course, all these people are non-desk-based workers, aren't they? Oil rigs, wow, that just goes to show what an amazing array of different companies we've got on today's webinar. Construction on radiological sites, nuclear emergency defence, etc. So many different types of non-desk-based workers, aren't there? That's really, really interesting to see. Manny, do you think you could share the results of the poll, please? Okay, so let's have a quick look here. So we've got lots of different people here. Majority are in other, which is interesting. 29% warehouse, 32% logistics, 18% manufacturing, 25% construction, 25% healthcare. That's really interesting. Thank you. What the main challenge is? The main challenge here, 55%, is physical demands. That's interesting to see. Shift work is high on people's agendas as well as stressful work environments, psychosocial hazards. But only a few people have put low health literacy, Kate, which is interesting. And the third question, sorry, my voice sounds really awful. How advanced is your support of non-desk-based workers' health and well-being? So 76% have a range of well-being support, but are struggling to get people to engage with it. So that's really interesting, and that's something that we're going to be talking about. A few of you, 17% are struggling to get started, and 25% are interested in a kind of holistic approach that also covers shifts and agile working. So thank you very much, everybody, for taking part in that poll, and apologies again for my voice. It's a little bit croaky today. I'm going to ask the panel to introduce themselves. First of all, I just need to let you know that we do like our sessions to be as interactive as possible. So please share your ideas and experiences in the chat. We'll be keeping an eye on that as well. If you've got questions for the panel, please pop them in the Q&A so that it helps me to pick them out. And I'll try to feed them to the panel as we're going along. So don't keep them all to the last minute. I also wanted to let you know that today's webinar is being recorded, and you'll be able to, you'll be sent a link to the recording and a copy of the slides that Kate's going to show tomorrow. Okay, I think probably that's everything I needed to say. Kate, first of all, is going to show us some slides to kind of put the conversation into context, and then we're going to introduce our three fantastic panel members who are all going to cover all these different elements of non-desk-based working. So over to you, Kate, first. And I'll rest my voice now.
Okay. Well, hopefully my screen is now sharing and everybody can see. And welcome everybody. Thank you very much, Claire and team, for inviting me onto this panel. My name is Kate Platts. I'm Head of Research and Innovation for Westfield Health Group. We are a health, cash plan and employee wellness service provider. We have a large network of corporate gyms across the UK and Europe. And we also have a research partnership with Sheffield Hallam University where we explore issues in occupational health, basically. So the reason that I'm here today is that we've done a lot of research into the challenges and potential solutions to support non-desk-based workers. We ourselves have a number of large clients across UK and Europe who fall into this space, mostly in the manufacturing and logistics sectors. So we do have quite a lot of practical experience of working with employee cohorts in this space. So let's move on. I'm going to try and move my slide on. Okay, so first of all, I thought it might be useful just to clarify what we mean by the manual workforce or the non-desk-based workforce. And as we've already seen from the poll, there's a huge number of jobs that don't require people to be at desks. Only a few are mentioned here. Very different in the public and private sector. Public sector examples, obviously, we've got, for example, someone put in the chat about refuse workers, really very physically demanding physical job in a public sector environment, but then you've also got lots of different physically demanding jobs in the private sector too. And just because jobs are non-desk based doesn't mean they're all the same. So again, somebody put in the chat field sales, road-based engineers, so telecoms engineers, for example, who are constantly traveling around and being not on a particular site. So even though people are non-desk based, or manual workers, we can't lump them all together. There are lots and lots of different cohorts in this area, and all of them will have different challenges and different needs. For the purposes of today, I'm particularly focusing on manufacturing logistics because that's where we have most of our expertise, but a lot of the findings can be generalized across the entire sector. So first of all, this won't be news for a lot of you working with non-desk-based workers. Characteristics, you can generalize about characteristics of people in this cohort. Predominantly male, particularly in the UK, we have about 80% of our non-desk based workers are male in the UK, generally with a lower educational attainment and lower socioeconomic status, which has an impact on things like health literacy, access to healthcare. We'll come on to that in a little bit in a moment. In terms of health outcomes, we see vastly higher rates of musculoskeletal disorders, cardiovascular disease, stress and obesity. And again, as my colleagues on the panel, I'm sure will talk about, this leads to higher rates of sickness absence and early retirement in this cohort. cohort, sorry. We also have a higher average age of workers in the manual workforce. So average age of logistics workers in the UK is about 48, which is about 10 years older than the general average working age. So obviously, people being older, physically demanding roles places a greater toll on the body. This leads into serious sense of stress, and maintaining a work-life balance in times of stress is challenging, especially when you consider things like shift patterns and night work. Also, traditionally, we see in this cohort lack of engagement with wellbeing initiatives. And again, I'm sure my fellow panelists are going to discuss this, but this correlates very much with the male demographic. We know that men generally are less likely to engage with wellbeing initiatives and seek wellbeing support at work. So this is a complex picture, but this is some broad general characteristics of this cohort. So then the challenges faced by this cohort, again, these will be familiar to a lot of you: psychosocial hazards, stressful work environments, often noisy, often lacking in natural daylight, often smelly as well. There's lots of different psychosocial stresses that can affect people in manual workplaces. Lack of autonomy when people are working shift patterns. They might be working on production lines where they can't step away for breaks, even for toilet breaks at times of their choice, increases levels of stress. So we've already talked about physical demands of the job. I noticed 55% of you, so more than half, said that this was the key challenge that you were facing with your workforce. Physically demanding jobs, so heavy lifting, strenuous work, contributes to chronic health issues. Also contributes to mental health issues. Major challenge faced by non-desk-based workers is dealing with stress, anxiety, and depression. And that is exacerbated by shift and night work, which we often see in this cohort as well. And finally, one of the major challenges we face is the physical activity paradox. Now, some of you will probably be familiar with this, others of you may not be, but traditionally we consider physical activity to be healthy, but the physical activity paradox highlights that high levels of occupational physical activity lead to poor health outcomes. So kind of the opposite of leisure time physical activity. That's a really, really interesting thing, especially for those of you that have highlighted physically demanding jobs as one of the main challenges. I'm just going to talk about that just a little bit longer. This is a complex looking slide. It's not that complex. It came from a study that was published in 2017. Basically, it seeks to describe the mechanism behind the physical activity paradox. So as I've said, we tend to think of physical activity being healthy, and it indeed, leisure time physical activity is healthy. It tends to be of short bursts of activity, but working at long hours at a sort of low or moderate intensity can keep your heart rate variability uneven. It does not improve cardiorespiratory fitness, and it can increase blood pressure and inflammation, all of which lead to poorer health outcomes. So while we very often, especially in our line of work, we turn to physical activity as a remedy for physical and mental health challenges, it may not always be the case that people working in manual roles will benefit in the same way from physical activity. We should also consider the element of age. So where we've already talked about, generally speaking, the manual workforce has a higher average age. That will also have an impact on physically demanding roles where you've got repetitive and heavy load, particularly in sort of manufacturing and logistics contexts.
Just to throw you a slight curveball, Kate,
Yes.
A couple of people have mentioned that their non-desk-based workforce is predominantly female. So just goes to show how hard it is to generalise.
Yes, and I should say, and it's a really good point, it's male generally not in the private sector. So where you've got education, healthcare, social care, those manual roles tend to be female heavy for sure. In the manufacturing, logistics, utilities and engineering, it tends to be male. So yes, our colleagues on the call are absolutely right. It very much depends what sector you're in. And that's why obviously it's different everywhere you go. So finally, barriers to health improvement then. Again, these are things that my colleagues will go on to speak about, but financial pressures, very often people working in more manual roles are earning less money. This is a statistical fact. So, you know, financial pressures, lack of social and family time because of shift patterns, challenging work environment we've already talked about, low health literacy, which means a lack of understanding about how to improve health and a lack of understanding of how to access support, and then limited access to healthcare that is associated with lower socioeconomic status. So really complex and challenging situation for people working in manual roles.
Yeah, no, that's great. Thank you very much.
I'm going to just hand over to my colleagues now, just finally to say there's lots and lots of evidence about what works for people in this cohort, which I'm sure my colleagues will be covering. If there's anything else I can provide to our listeners, please don't hesitate to reach out.
Fantastic. Thank you so much, Kate. And I think that we've seen the diversity of different sectors here, haven't we? And how hard it is to generalize, but we're also keen to see what parallels we can find across different sectors. So I'm going to just use this opportunity now to ask the panel members to introduce yourselves. Could you just say who you are, what you do, and kind of what your business is, please? So Karen, please, over to you first.
Yeah, my name is Karen Brookes. I'm the Chief People Officer at a company called Sir Robert McAlpine, which is a Tier 1 construction business.
Fantastic. Thank you very much. Penny, can you introduce yourself, please?
Yeah, I'm Penny Hamilton. I'm Head of People for Wincanton. I also lead the corporate Wincanton Wellbeing agenda. We employ in excess of 19,500 colleagues across the UK and Ireland.
Fantastic. Thank you very much. And Faraz, can you introduce yourself as well, please?
Morning, everyone. So I'm Faraz. I'm Senior Service Manager for Occupational Health at Jaguar Land Rover. Hopefully people know what that is. So we make modern luxury vehicles.
Fantastic. Thank you very much. And what I'm going to do is come to each of the panel members in turn, because you've actually got quite, you're all taking very far-sighted approaches to supporting non-desk-based workers, but all in a slightly different way, and it kind of flows quite nicely. So I'm going to come to you first, Faraz. First of all, what do you make of the research that Kate's shown? And Vashti, I have seen your question, by the way, so we'll see if Kate can answer that later.
Yes, Claire. So I think it resonated. I don't think we'll be alone when it comes to that. I think diversity is a huge factor here. So we have just a bit of a summary. So over 40,000 people globally, the vast majority in the UK, around half of those will be desk-based, so to speak, professionals. And that varies incredibly a lot. So we've got lots of Gen Z coming in from design and engineering, but the 50% that are left that are what you call blue collar, the vast majority of which are our production employees, so the people that actually make the cars. And that in itself has a lot of diversity as well. And what Kate was saying was very relevant in terms of what we find in terms of the paradox. So they have a physical job, they're on their feet all day long. However, they're the ones that have the highest kind of risk profile in terms of ill health, and the hardest population to get at. And I'm sure we'll talk a little bit more about it later in terms of what makes that difficult and what we're trying to do is to try and address that.
Yeah, fantastic. I mean, you're taking a really kind of proactive and preventative approach, aren't you, at Jaguar Land Rover? Can you tell us a little bit about that? And also, it was interesting to see that the majority of the people today are finding it hard to get their non-desk-based workers engaged with the support that they offer. I think the approach that you take is really interesting. So if you could tell us a little bit about that as well.
Of course, just a little bit more context in terms of production employees. One of the things that makes it most difficult is that they're very time poor. So in manufacturing, if you can imagine, if someone is not putting in a part and they're gone for 5 minutes, then obviously the line stops. So it's a very hectic, pressurized environment, and we need people to be at that workplace all the time. So they don't have a lot of breaks in between. So from a physical availability perspective, it's really difficult to try and get at those individuals. So what we've done is, I guess, a tiered approach. First of all, we tried very hard to try and change the culture. So in terms of physical and mental health, we've worked very hard to try and bring them into parity with one another. So that's gone over a period of many years to try and destigmatize, I guess, health in a holistic perspective, but in particular around mental health as well. In addition to that, we know that occupational health plays a central role. So we worked very hard to destigmatize occupational health to make sure that people have a trusting relationship with them, and also managers to be able to refer into us, with early intervention in mind. However, we know that every interaction that we have with individuals is really important. So because it's really difficult to try and get these people voluntarily, so going back to the easy get out population of office workers, if we put a wellbeing event or a health desk or whatever else it may be, it's very easy for them to walk away from their work and come. So with manufacturing, what we've done is every particular interaction we have with them, we've tried to make it very engaging. So we've developed programs with an NPS in mind, so Net Promoter Score. So everything's about them enjoying the experience. So even a health check, even an occupational health visit, all the programs we develop, at the heart of it is making sure that that individual is engaged with it and is wanting to actively participate into it.
Yeah, that's fantastic. I think you actually do achieve a very high score, don't you?
Yeah, absolutely. So when we start designing programs, we aim for an NPS of 80. And I don't know whether all the participants are aware, but it's quite difficult to try and get that high because only a 9 or a 10 out of 10 basically contribute to a positive score. So we have programs, for instance, we have a program called Live Well, which we bring people off the line for about 3 hours, and they're in groups of 12, and they go through what would be deemed as almost like an NHS health check component, but it's wrapped around an experience. So we have workshops, we talk about nutrition, we give them a free lunch, and that in itself for that population has an NPS of around 87. And we continue to iterate on it to try and make it more and more engaging for them. But we found that obviously that is probably the best piece of marketing that we have, because people go back onto the shop floor and they talk to their colleagues, etc., and encourage them to participate as well, instead of obviously managers having to pick people and forcibly kind of release them into these programs, which doesn't have the same impact.
Yeah, there's an interesting comment here from Tricia in the chat. She says, in my experience, when line managers role model by attending wellbeing sessions, their teams are more likely to attend too. Do you find that?
Well, absolutely. And that is a concerted effort on our behalf as well. So all these programs, we've had managers to go through either an immersion session or the full thing. And in fact, we invested into our senior managers to have a wellbeing program of their own, but not any old program. So we didn't send them off to get a Nuffield health check or something like that, where it's outside the business, but we had our own medical teams go through a program with them, so the managers are fully aware of the resources that are available to their colleagues, but they're also understanding of the breadth of services that are available at JLR. So it's much easier for them to be able to signpost their people to it.
Fantastic. I've got another question here from Keris. She says, Faraz, what steps have you taken to destigmatize occupational health and build that trust with your colleagues?
Yes, it's a really good question. So there's no silver bullet with that, but that has been years in the making. So what we have done is worked with our managers, for one thing, in terms of for them to be skilled in people management. So being able to position occupational health from their perspective, that it's not a stick and it's supportive. So they come along on the journey as well. But again, going back to that interaction, every interaction we have with individuals counts because it's so limited. So we have trained our staff to be empathic, for it to be transparent, for those difficult conversations to be done in a way that we're not confronting an individual in a way that they distrust occupational health. So it's that tightrope you walk where you're having an outcome report or advice that goes to a manager that helps them deal with the case, but also you're helping support an individual in and out of work as well, so they're thriving in and out of work. So over a period of time, you build that trust, but it's not a quick solution.
Right. Yeah. Yeah. There's lots of questions coming through for you here. How do you manage the workload expectations, taking colleagues away from work? So you did mention, you touched on that, didn't you?
Absolutely. So again, goes back to that trust. So when you have from CEO down, have a complete trust in occupational health and well-being, and I fully understand it. Not in terms of just a business objective, but actually it's the right thing to do as well. You have that trust to be able to for them to actively support the service. However, we know that by getting the advice to the individuals, to the managers, to helping them resolve cases and to get the best out of their teams, has slowly been building trust so people do not refrain from sending people away for occupational health, because they see the benefit. The individual sees the benefit, the managers feel the benefit. And again, over a period of time, you build that rapport with the business, so to speak.
So it's about taking that kind of re-emphasizing the proactive, preventative approach and the benefits of that, because it's constantly banging the drum.
Absolutely.
Okay.
And we've gone on a journey from becoming, into early intervention. When something goes wrong, people don't sit on a case, so they allow individuals to interface with us, to now being more proactive as well. So in fact, now we've gone one step ahead, like you say, Claire, and we have programs where there is no problem as such, but they're releasing individuals for those 3 hours because they know that that is going to support them. They're less likely to have time off work, less likely to get diabetes. There's a whole raft of things that we're potentially helping that individual in their team to come back and be a more productive employee as well. But there's a big journey that we've gone through as a business for management to follow that journey with us. But once there, the data starts to support it as well.
Right.
The
and you do take a very data-driven approach to try to personalize messages as well, don't you? And so forth. It's just incredibly thought through as well. There's actually lots more we could say, but I'm conscious of time, so we may come back to some of the other points that we were going to address. Sure. One of the things that we chatted about before when we were kind of had our prep call were the challenges of shift working and the impact on circadian rhythms, and you mentioned that is a challenge. And actually it's at this point that I kind of wanted to bring in Penny from Wincanton. Penny, can you tell us a little bit about what you've heard so far, and where does that resonate with what you're finding with your workforce, and tell us a bit about the demographic of your workforce as well.
Yeah, it does, and I think I've listened to both Kate and Faraz, and it's interesting where a lot are breaking down the barriers to well-being and mental well-being. We operate 24/7. We operate across many different sectors, and our demographics, when you're talking about non-desk-based workers, out of our circa 9,500, 20,000 colleagues, we've got about 6,000 drivers and about 9,000 warehouse colleagues. So non-desk-based workers, 24/7, multiple shifts across multiple sites, across multiple disciplines. And I've listened to how people are looking at breaking down those barriers to support and getting more colleagues coming forward. And what we found with raising the awareness and our commitment, so we approach mental health and well-being bottom up, top down. And I think only by approaching it bottom up and top down can you get the buy-in of the whole organisation. And I think somebody's popped in the chat about getting line managers involved and attending wellbeing events. That is so important, but also giving all the organisation the tools, the training, the awareness to be able to have the confidence to start those conversations about mental health and wellbeing. So we offer a lot of training within our organisation. We have mental health first aiders, we have suicide first aiders, because we know within our industry, and when you look at the demographics, male suicide is so high. And then we've got start the conversation training, which really raises the awareness, giving people the tools and the confidence to start those conversations, therefore opening up a transparent workplace where from the bottom up and the top down, colleagues are willing to share their stories, are really willing to open up to their own challenges. And what we found, Claire, is that's really a game changer for us.
Mm.
So our mantra for the journey that we've gone on in this space is looking after ourselves and others. So what can Wincanton offer our colleagues, but also what commitment are our colleagues going to give to the remaining workforce? So how are they going to support themselves and others? And I know when we spoke, and Faraz has spoken about sort of being proactive, you know, we are reactive when somebody goes into crisis, but we want to be proactive to hopefully prevent those colleagues going into crisis. If they are going into crisis, really signposting those colleagues to the support organisations across the board. So we've spoken about occupational health support, management referrals, and how we can do that within our organisation. However, what we also do is partner with the retail trust and Mates in Mind, independent of that occupational health support. And what we found is that breaks down those barriers, increases that trust from our colleagues, because actually we don't receive a report from those organisations unless a colleague wishes to share it with us. They can reach out, gain that support, gain that proactive support. And interestingly, what we have done is open that up to our colleagues' families. So their immediate dependents, so they can see that this is not a tick box exercise. This is something that we truly believe in. The health and well-being of our colleagues is so important for any organisation. And, you know, we look at mental health and well-being as important as physical health and safety. Whereas if you look back several years, many organisations concentrated their focus on physical well-being and health and safety. Well, mental health and well-being is as important.
Yeah.
And
yeah.
I know,
And you said it's been a game changer, didn't you? The sort of adding the family support as well.
Yeah. And I mean, raising that awareness has really helped us break down those barriers.
Yeah.
And I know we spoke about, Claire, how we listen to our colleagues, how we promote wellbeing activities on our sites, but then looking at different shift patterns and the demographic that we work with, we've had to look at it differently. So it's, you know, we've got all our non-desk-based workers and drivers out on the road that you can't just reach through, unfortunately, a webinar or through a laptop. So we've utilised different media to really reach out to those colleagues. And I think that is vitally important. So whether that's newsletters, whether that's holding events, whether that's using podcasts, whether that's promoting our activities through driver debriefs. You know, you've got to think differently when you're operating across 24/7 and you're operating with shift workers. And also, when you look at the changing face of the labour market and the demographics that are coming into all our industries, younger adults are looking for something different, and they are looking to explore what an organisation has to offer, and not just reward, but holistically, what else is that organisation offering to me if I'm going to join them? So if you've got a fantastic wellbeing agenda that really looks after your emotional wellbeing, your physical wellbeing, your mental wellbeing, your financial wellbeing, and you can tap into that, I think that for all organisations is of vital importance.
Yeah, and I think that you mentioned that you're using something called Labour Campus for shifts.
Yes.
Can you just tell us briefly how that works? Because I think this kind of traditionally people who work in non-desk-based roles who do shifts, one of the issues I often hear is that they have so little control over their, you know, time, and you know, they don't have this locus of control that we all know is so important and underpins our well-being. But it sounds like the Labour Campus is a way of getting around that.
So what we've actually introduced, so we recognise the changing face of the labour market. We recognise we needed to do something different. Traditionally, we're 24/7, any 5 from 7 over weekends. that wasn't tapping into a pool of colleagues who wanted more flexibility. So whilst we can offer part-time shift working on a permanent contract within a specific location, what Labour Campus allows us to do is offer true flexibility of shifts. So where you've got somebody that may only want to work 4 hours a day over 3 days, we can offer that, because that Labour Campus model allows for that labour planning and that labour modelling to support organisations. So if you look traditionally where an organisation was looking to flex labour, they may use an agency and an agency model. This allows us to employ people on permanent contracts within Wincanton, but also work for their needs. And therefore, if they've got dependents at home, if they've got young children that are at school and they want to work during school hours and then their partners want to work in the evening, we can flex that. If they only want to work on a weekend, we can flex that. And that allows a greater autonomy for those individuals to join Wincanton, but also allows our operations to be supported by Labour Campus and therefore be able to plug some of their recruitment needs.
Yeah, fantastic. So thank you very much for that. We've got some questions coming through, so I'm going to put them to everybody. How do you reach people who do not go into a central hub? It says, my non-desk-based workers usually work on their own remotely and do not go into a local hub. How do you reach them? Penny, first of all.
So we've got a Wincanton intranet. So if they don't go into a local hub, but they've got access to a local intranet, then they can access our Wellbeing community page, which has all the tools that anybody working on a site that is non-desk based, so in a warehouse or driving, can access. We also send out newsletters to those people that are not working in a central hub. And I think that is really important with any wellbeing agenda, that you keep that engagement across the board when you've got a diverse range of colleagues.
So is that a hard copy? Is that actually paper newsletter? Oh, right, okay.
Yeah. So very old-fashioned, I know. But then we've also got you've got email addresses that you can actually send information to. We use an app within Wincanton that you can actually send messages to, and then we've got drivers obviously that use Tachomaster and everything else that we can actually direct messages through to those.
Right.
But we use every different media, so the old-fashioned paper that people veer away from, but that sometimes lands really well, because not all people, colleagues, have an iPhone or want to use an iPhone, and it's like somebody reading a book, isn't it?
Yeah.
They want to read it on paper.
So Karen, how do you reach those hard to reach? Have you got anything you'd like to share there?
Probably not dissimilar to Penny in terms of a vast array. Obviously, everything is available online. We actually go out. So we have people on project sites across the UK. We have people who work shift patterns on the A19 ROMs, on the M6 ROMs, in terms of looking after the motorway network, that work 24/7. So you have to organise things around those individuals. So they made me think, Faraz and Penny, in terms of, we used a company called Acting Out. I didn't talk to you about it. And they're run by a clinical psychologist, occupational psychologist, and an actress. And actually, they've done some brilliant sessions for us. And we've gone to project sites and the A19 M6 ROMs and done sessions different times during the day, so that we can run a session that's particularly about mental health. As Penny said, we have very high suicide rates among males within construction. So it was acting out a session that was about Sir Robert McAlpine in a real environment. And you've got a line manager having a conversation with an individual about their performance at work wasn't where it needed to be. And everybody watches how this happens, and then we get the audience to then interact and say, okay, what should the line manager do differently? What should your colleague be saying at this point? Because what you don't know is that the colleague's got lots of problems at home. His wife's just texted him and said she's leaving him and taking the children. And it was about opening up that dialogue and saying it's okay not to be okay, and it's okay to talk about it, etc. And we found those sessions, and we've done that for lots of different scenarios across our whole workforce. Really good in terms of that, just getting people to open up and to talk about it.
Yeah, just
Yeah.
getting people engaged, even if they can't come into a central hub or
Totally.
yeah, okay. Yeah, and actually this responds to Anna's question as well, which is a similar question. It's about how you break through the IT as a barrier. A lot of manual workers don't have IT, aren't IT literate, and don't have access to tools like that. So it's about tuning into what they do use, isn't it really?
It is, and I think as well, when you've got individuals like that, we've worked really hard in terms of getting people to access their pay slips on our Dayforce payroll system and HR system. But to do that and to recognise that some individuals don't want to choose to do that, we make sure there's support on site. So the office manager or the document controller can sit with someone and help them get access to it on an online terminal or laptop at work and print off whatever they might need, etc. So it's about responding to an individual. I mean, I use at SRM, one size does not fit all. One size fits one. So we try to make sure that each thing we provide is unique and specific to the individual. You know, so
Yeah.
I think that's really important.
Yeah, it's a lot of work, but it pays dividends, I should imagine.
It does pay dividends, and I think Claire mentioned about, you know, your financial offering, your wellbeing offering, whether it physical or whether it be mental health is really important. And I guess trying to be agile and flexible working on sites. A lot of people will understand construction, unfortunately, is still very male dominated. Um, and we certainly didn't have parity in terms of when someone's off for maternity leave. So we decided to be quite radical in 2019 and introduced 26 weeks paid maternity or paternity. So it didn't matter whether you were male or female, what your family makeup was. If you were adopting, you were allowed to have that 26 weeks. And we've had lots of barriers. Not all customers like it. You can imagine when they see the project director going off for 6 months, which generally speaking, because there are a few females in construction, they don't see that on a regular basis and of course replace them. But I think it's choice and giving people the opportunity to do these things and that mix of your offering. And it's subject to affordability, I think is really important in responding to that one size does not fit all. And I guess
Yeah, sorry, go on.
I guess one of the other things that we've done, we worked with TimeWise on a trial on site. So I was told when I joined construction over 8 years ago, you can't work flexibly on site. It doesn't work. And I thought, okay, that's a really interesting comment. So we did a trial on 6 sites and we gave the people on site the opportunity to do what they wanted to do. So as an example, we had one site that decided they wanted all to finish at 12 o'clock on a Friday. So they were going to work longer hours, Monday, Tuesday, Wednesday, Thursday. So clearly we had to clear that with the clients. We had to clear that in terms of with all the supply chain that worked for us. So everybody needed to do that to make sure we could keep everyone safe. So that was one of the things they did very successfully, delivered the project on time, no issues. Another project wanted individual flexibility. So how they implemented agile and flexible working on site was having a buddy. So you're paired up with a buddy and you actually do that person's work for the few hours or the day that they want to take flexibly so that that's covered. So, that obviously, and we've written our policy now, having rolled that out nationally across the country in a way that means when you set up a project site, actually you get the whole cohort together of the people on the project and you decide what do you want to do as a group. We don't dictate what's done. And you have every kind of, you have condensed working weeks, you have obviously part-time hours, you have the people who are just taking flexibility as and when they need it. So
But I mean, it sounds like it's a lot of effort on your part, but you find again that it's worth it.
It's absolutely worth it. It's tough. There aren't enough people in construction, so resourcing the numbers that we need is really hard. I'm sure my colleagues are all in the same place. It's hard out there. So doing everything you can to seek to, one, to attract them in the first place, but two, to retain them and make sure they stay. You have to show points of difference. That means
Yeah.
your organisation's better than going somewhere else.
Yeah, yeah, definitely. And I loved when we were talking before, Penny, you were talking about how the kind of flexibility that you're able to offer means that you can keep older workers in the workforce for longer as well as sort of meeting the needs of the younger workforce, which, I think is brilliant. But Faraz, what do you make of what Penny and Karen have been saying?
I think we're a little bit more centralized than some of those businesses. However, it resonates strongly. So I think flexibility is absolutely key. So we go into everything with an open mind, just measure, and I think it was mentioned piloting things.
Yeah,
Some changes are just too significant, big to think about initially. But if you pilot it, break it down, before you know it, you've done something like Karen was saying that you would have never thought was possible beforehand. And I think varying the ways you reach people is quite important, because sometimes in our offices we just are transfixed with emails or mail shots, etc. But actually in the workforce, it doesn't resonate with them at all. So we know that for our production employees, paper works. So we do. I know we want to be paper free as much as we possibly can, but actually a piece of paper that they can take away with phone numbers on it and what they can do next after the health check is a real significant thing for them. And human contact. So we invested in our centers for wellbeing to have an administrator or a reception person to meet and greet them. So instead of just relying on an online appointment calendar they can book into, they can call a number, talk to someone, and book themselves in that way as well. Affording people that flexibility definitely does help those interactions.
fantastic. Kate, you've added something in the chat here as well, some thoughts about how you can reach the hard to reach.
Yeah, I was thinking about the listener who made a comment about people being on the road and how we've seen some success with audio content. It's so easy now, isn't it, to make videos, short form videos, podcasts, recordings, etc. Particularly for a road-based workforce, this is a really good way to deliver content. And perhaps when people are getting overloaded with emails and people do use intranet, but probably not as much as any of us would like them to use it. So we've seen some success with audio content, which is just something that people may not have considered.
Yeah, I think people are listening to podcasts and that kind of thing much more than
Yeah.
they ever used to, aren't they?
Yeah.
And the other thing I've heard people talk about in the past is just a good old fashioned putting signs on toilet doors and things like that, just making sure nothing's left unturned, really.
Yeah.
Was there anything else that you wanted to comment on, Kate, around what the other panelists have been saying?
No, I'm so fascinated to hear what my colleagues are talking about, because obviously we have some of our own clients that are in very similar industries. And one of the things that hasn't been mentioned that I think it might be interesting to the audience is that we've also seen a lot of success with our clients where, as my colleagues have spoken about, people can't step away for long periods of time. They have very short breaks, very fixed breaks. Where we've seen some success is having rest and recovery spaces on site in factory settings, in warehouse settings, where a small space has been set aside for rest and recovery purposes, preferably, soundproofed and quiet, but, not always possible. But I'm talking about almost on the shop floor, where people can sort of take 5-10 minutes, they can go and power down, they can, we've used technology to support with relaxation and de-stressing. So we found some really great results with things like massage chairs and hydro massage boots, vibroacoustic therapy, where people kind of lay and get massaged and listen to music, even virtual reality, where people put on a mask and kind of immerse in a different world for 10 minutes. These things seem a bit out there, but actually studies have shown that even 5 or 10 minutes in that kind of sensory deprivation space can really downregulate and really reduce stress and increase relaxation. So where people have very short amount of time to rest and recover, and they can't go very far, we've seen some great responses. Obviously not relevant for everyone, but you know, that's a new area of developing research about how you support people on site in those kind of settings.
Yeah, I've seen those around for a while actually, and did wonder who was using them. So
yeah,
good, that's good to hear. And I've heard about use of quiet rooms as well, you know, just setting up a space where people think they can, you know, there may be a wellbeing ambassador or somebody there in that space, who can sort of be a friendly ear if needed.
We
So
do have a wellbeing room on
Yeah.
every project. Yeah. So people can. There's some books in there. There's a comfy sofa. You know, it's a bit like a little room at home, lamped, coffee table, and all of that kind of stuff. So yeah, people are able to go and do that. But
And you find that people use them.
they do use them. I think it's a bit more difficult when you're on a A19 ROM and it's a 24-hour shift, etc. But yeah, they do use them.
I guess it's like somebody said in the comments that you know, if one person uses something and advocates it, then that's really, you know, getting people to share their stories around how they've used the tools that are available can be a really great way to kind of get more people on board.
Definitely, I think something we found that's been very helpful with that is where people are comfortable sharing their experience. So talking about the fact that they've had a mental health issue, and what they did about it, and what was helpful, and especially when it's a big roughy tufty structural engineer that's in their 50s. That's really powerful in terms of getting other people to talk and to share. So yeah, we do that regularly. You are reliant, of course, in terms of people obviously clocking onto the intranet, or you're looking at links we send on phones, etc.
Faraz, you've just added also to the chat, integrating health and wellbeing messaging within all opportunities, for instance, town halls and start of shift meetings, so it becomes part of normal business is really important as well. Faraz, I just wanted to come back because you're doing such great work encouraging healthy eating. I was wondering if you could just tell us a little bit about that. Why did you think that was important, and you know, what approach are you taking?
Sure. So I think it's just understated how much food has an impact on our health. I think for us as professionals, we kind of realize, but as a wider society, it's something that's not really recognized. So I think, first of all, we wanted to pin our North Star on something that's evidence-based. So we looked towards the Eat Lancet report, which came out a few years ago, and I think they're doing a revision. But there's a thing called the Planetary Health Diet. And so it is very plant forward. It's helpful for the sustainability of the planet, but it's also helpful for trying to stave away from all the preventable diseases like heart disease, etc. So that was our target. So what we did was, it's multifactorial. So we worked with our catering company. We made sure that we had worked on the psychology of food choice. So, for example, when you go into your store at the tills, there's typically confectionery, your crisps and so forth for the spontaneous purchases at the end. So we worked on trying to remove those from our catering provision. But we also worked with them to try and help to put the healthier options at the forefront, at the top of the menu, make it more appealing, remove some of the stigma around it, so not calling anything vegetarian or vegan or anything like that. So take away that kind of "it's not for me" mentality that most people have. So it's more around the taste and the textures and the pleasure they'll get from it. But I think from all the things that we did, so all that started to nudge the consumer behaviors. But the one thing that did help most of all is where we discounted. So we have a range called the Good Stuff offer, which obviously is high in fiber, it's good for the planet, good for them, etc. And we subsidize those by 50%, and that has increased the uptake for it immensely. So we're continuing on this journey with our catering provision to try and increase those nudges, look to see where we can put our money in so we can subsidize it. and strategically change things like, for example, within vending, because we know shift workers don't have the access to catering as much as day shift workers do. So let's try and replace some of those things that are in there that typically are high volume, but not great for them, like energy drinks, etc. So it's a journey that we're going on, but it really needs to be in partnership with the catering company that you're with. It's wrapped around education. So every interaction we have with individuals, we talk a little bit about nutrition, about how you can look after yourself, how it impacts your mental health. So again, it starts to bring up the nutritional literacy a little bit, because it's quite poor in the wider society.
Yeah, no, and I guess what you're doing by offering that is also you're just constantly reinforcing this message that you're a company that wants, you know, colleagues to be healthy and well. And what do you think, Penny and Karen, about that approach? And Kate, Penny, what do you think you could? Do you think you could encourage it? Do you already encourage your colleagues to be healthy eaters?
Do you want me to kick off
Yeah,
first?
go on, Karen, you go
We have canteens, restaurants on every site, irrespective of whether they're in the heart of London or whether they're right on the coast in the middle of nowhere. And we try to ensure that there is obviously a wide range, but definitely a healthy range. It's all fresh. And yes, I agree with Faraz. You have to work with your catering provider, because obviously we don't provide those services personally. But yeah, it's something that you can do, and clearly we'll do specials. It's all subsidised, so they get it at a heavily subsidised price. When they're on site, which is why people tend to stay, and there are big refreshment areas where they can chill out, and there's TVs, etc. So Faraz is right. I think it certainly does help. It helps keep people at work. It helps keep people healthier, because you are working with individuals who generally have low knowledge in that area in terms of what's the best thing to do for their overall well-being.
Yeah, no, that's really interesting. Penny, what about you? Do you support healthy eating as well, or?
Yeah. I think for our organisation, we support healthy eating. We do healthy eating campaigns as part of our wellbeing agenda and our wellbeing rollout. When you're looking at some of our drivers are on the road in the cabs, they could be in the cab for 8 hours delivering, to retail stores, back doors and convenience stores. So sometimes that's more challenging. So I think whilst you have canteens on site, and as Karen has said, many of our sites are subsidised depending upon the customer you work with, because some of those are customer canteens, but we always look to allow colleagues to have access to those canteens on those sites. We encourage healthy eating, and we encourage all our sites to hold campaigns throughout the year on healthy eating, and really looking at their own health and well-being through many of our apps and through occupational health.
Fantastic. So, I mean, Kate, what would you add here? And sort of we're starting to think about wrapping up. So, what do you think about encouraging people to eat healthily?
I love what Faraz was talking about in terms of, when you think about, particularly in the manufacturing and logistics centre around, and construction, of course, around predominantly male workforce, again, a lot of research that meat attachment is very, very strong in the male demographic. The words vegan and vegetarian can be off-putting, and there's no need for them, those words, right? So as you were saying, Faraz, focusing on the content of the food, so the taste, the texture, talking about protein, men like to eat protein. I mean, I'm making real generalizations here, but there is research to support this. So thinking about the framing of the food that you're offering, and the narrative that you're using relevant to the cohort you're talking to, and how you influence the psychology of what, how people are thinking about the food they're eating is really, really important. So I love to hear that that's actually happening in practice.
And what would you say would be one key takeaway that you'd like the audience to take away from this? And we just had a question about low cost approaches, so I might ask the others that, but just one key takeaway that you'd like the audience to take away today.
I think my key takeaway would be that because this is so complex, and as my colleagues have said, there are no one size fits all solutions. There are no silver bullets. Listen to your people. They will tell you what they need. That is, that's the best thing you can do, I think.
Yeah, so do the listening first and
listen
ongoing.
Listen first, act second. Yeah, absolutely.
Penny, that really resonates with something that you said to me when we were chatting earlier, which is about making sure that you listen to everybody and respect everybody.
Yeah,
What would your one key takeaway be?
I think for me, no approach is the wrong approach. If you've got a bottom-up approach to your health and well-being agenda, that's the first win. Then you get commitment and the support from the top. If you can join all that up in the middle, you've started to create a change in culture, a shift in the journey, and this will never end for me, and don't ever let somebody take the passion away. If you are passionate about this subject, then just keep driving that forward.
Yeah, fantastic. And Faraz, what would be your one key takeaway for the audience?
I think I'd add, just remain flexible and agile. We don't, always get it right. So as long as we measure what we do, we'll continually improve and adapt to the people that we're trying to help.
Yeah, so it's that measurement piece is so important. Don't forget to measure. And Karen, what would be your one key takeaway for the audience?
My thing always, and it's an approach I bring to whatever I do at work, is always remember one size does not fit all.
Yeah.
And I think if you do that, then, whatever it is, whether you're spending a large amount of money or no money at all, as long as you remember you need to tailor everyone's needs.
Yeah, fantastic. And there are lots of things you can do on a reduced budget. And
Absolutely.
if the person that put that question in right at the end, if you want to message me directly, it's claire@makeadifference.events. I'll send you some links to articles that we've published around that. Kate, did you have one last word before we say goodbye to everybody? Did you want from the... Oh, you're on mute.
Apologies, rookie error. Just thank you everybody for your time, and please feel free to reach out if there are, as Claire said, any questions that haven't been answered or you'd like more information from our research.
Fantastic, thank you. And we've covered actually a very wide range of issues here, so it's probably worth listening back to the recording as well, and you will be sent the link to the recording tomorrow, so please look out for that in your inboxes. And we'll also be sharing a handout from Westfield Health, which covers some of these topics that we've covered as well today. So it just remains for me to say thank you so much first to the audience. Lots of nice comments coming through. Thank you all. This has been brilliant. Thank you. Very positive and inspiring session. Great session. Thank you, everyone. Thank you, audience, for being so proactive. Thank you to our panelists for doing such great work, first of all, and really leading the way with this, and for sharing your expertise. Really, really appreciate it. It takes time to prepare for these things, so I do know you're all really busy, and I really recognise that. And thank you very much, Westfield Health, for sponsoring this webinar, because without your support, it wouldn't be possible to have these conversations. So thank you very much indeed, everyone. And apologies for the throat. I'll be better soon, hopefully. And I look forward to welcoming you all to another Make a Difference webinar very soon. Thank you, everybody.
Thanks.
Bye.
Bye. Thank you.
So